Hi guys, welcome back to the Jazz Street, and he is all about real life, real talks and real parenting hacks and everything in between. And today on our Real Talks, we're going to have a real talk about Coil. And I'm joined with the one and only Dr. Wanyoro, who is an obstetrician and a gynecologist. And he's going to tell us more about her Coil. And we're going to ask him a few questions and whatever you have been wanting to ask concerning the Coil. Welcome, Daktari.
Thank you, Maureen.
Yeah, and thank you for making time for us to ask you some few questions. So we'll just go direct to what is a coil?
Well, a coil is a group of family planning methods that are usually classified as long-term and reversible methods.
Yes.
We have two different types of uterine devices. We have the medicated and non-medicated. And the medicated could be copper releasing and hormonal releasing coils.
So what the hormonal one, does it cause weight gain in women, as people speculate most of the time?
I know one of the misconceptions is that the hormonal containing IUD, of course the commonest one known is called the Mirena.
Yes.
And it contains only one hormone, which is called progesterone. In some women, progesterone, especially progesterone, if you look at it, is a hormone that is found in pregnancy.
Yeah.
So when some women are using some hormonal contraceptive method, progesterone only, they may gain weight. This is more related to when a woman is using either the implant or the 3 months injection. But the coil itself, the hormone releasing coil, may not decrease the weight or change the weight.
Yeah.
Because what it does is that it releases a lot of hormones within the uterus, but very little goes outside into the bloodstream. So that is the main difference between progesterone injection, implant, and the hormonal containing IUD.
Also, this one is contained in one place, so the possibility of it making you gain weight are very minimal or zero.
They are very minimal because people complain about weight gain.
Yeah.
But remember, all of us, as the joke has been going, currently can add weight or reduce weight. It depends on what sometimes we are eating and what we are burning when we do our work.
And what causes bleeding? Because most of the times when I get people complaining about the T-copper, the coil itself generally, there are people who say they have heavy bleeding. At what point does it make someone to have heavy bleeding, or some of them complain that it stops? Your menstruation might stop or you have very heavy bleeding during the time.
Okay, thank you. That's a good question. One, all the methods that are used may have some side effects. There are some major side effects and some minor side effects. So, and you find many side effects will go within the first 3 to 6 months.
Okay.
So when we use copper T IUD, it may, at the first 3 to 6 months, a woman may notice that her periods are heavier than usual. But what is known is that this heaviness, she may change her pads more often.
Yeah.
But the total blood levels, we call it the hemoglobin, does not change. So the bleeding may look a bit heavier, but the bleeding is not significant to change the hemoglobin levels. Within 3 to 6 months, you find the bleeding has stopped.
Just stabilized to the normal bleeding.
Exactly.
Okay.
So on the other side, the copper, the hormonal containing IUD is the one that has been known to cause changes in the periods. Most women may have very scanty period or no period at all. And we consider that as an advantage. And this coil, the hormonal releasing IUD, is used to treat heavy menstrual bleeding in some women. because a few may have normal periods. A few may stay for some time, then they start spotting, getting little periods every day. And a few may also bleed a lot. Why they do that, they bleed, is because the way it changes the period pattern is because of what happens within the inner lining of the uterus. So the major mechanism, how the hormonal containing IUD works is in several ways. One, it changes the cervical mucus such that the penetration of the sperms is reduced. Then it also thins the inner lining of the uterus. So by that thinning of the uterus, sometimes you might find that because there is no estrogen support, then the woman may also bleed later, or they may also have that spotting.
So this is the point where your menstruation now starts having issues. Leo una spot, tomorrow you're spotting, and it doesn't come at a specific point.
Exactly. But remember, it is not like what people think, the misconception that the menses are accumulating within the uterus. No, it is only that the menses are not being made. Yes.
Because it has tampered with the normal...
The endometrium, the inner lining of the uterus.
That's something I never knew, but I guess someone has gotten to know. And pain. I think pain is one of the things that many people wonder. Is it painful when you're inserting the coil? Because today I'm going to experience it, so yeah.
Okay. So the coil insertion should not be painful.
Okay.
One, of course, remember, for us to insert the coil, we must use something we call a speculum. So this is supposed to be inserted into the birth canal so that you can be able to expose the cervix. Okay, the cervix is the lower part of the uterus. I call it the door to the uterus.
Okay.
So for us to be able to see the cervix, then you must insert the speculum.
Yeah.
Okay, and we use the smallest speculum in women. So this, you may feel a bit of pressure when somebody is inserting, and especially if that person does not lubricate the speculum properly. But with the proper lubrication and the proper relaxation, then you may not experience any discomfort. The other point that somebody may feel pain is when we go to the uterus. The pain is usually minimal, and we can give an injection on the uterus, on the cervix itself. So sometimes we give local or local anesthesia on the cervix. Okay, you minimize pain, especially for those people who may have who have never delivered and may have some little bit of discomfort.
Also, there is an option of anesthesia.
Yes, but give a local anesthesia. But remember also, every anesthesia has its own complication. If you inadvertently go into a blood vessel when you give an anesthesia, then that can also cause heart problems, heart fibrillation, and even heart. So normally, unless we recommend for those people who need pain relief, and even give some tablets before, several hours before. You can also give a local anesthesia, but majority of women you normally don't give, and it takes about a minute to insert an IUD.
Only a minute, so not a lot of time.
No.
1 minute is enough for to insert the IUD.
Exactly.
Both of them, the hormonal and non-hormonal.
Both of them, it takes a very short time to insert.
And there's also the thing of you need to be on your period for you to insert your coil. I think that is something they don't know why. Most people ask, why do I have to? Because also they think it's shame or you feel uncomfortable. They come without their period during that time.
We as gynecologists, we totally understand. Not many women would want to be exposed when they are on their menses. But there are two main reasons. Of course, a coil can be inserted anytime.
Yes.
But of course, the more remote from the periods, the more the chances that the cervix, the lower part, is closed completely. Remember, for you to be able to insert the IUD, you must use this inserter to go into the cervix. So this is the one, and then you deploy the coil inside the uterus.
Okay.
So when somebody is having a period, then the cervix is usually open. Is it true? So it is very easy to go inside,
To
penetrate without any discomfort. The other thing is, of course, most methods or all methods in an ideal situation should be started when a woman is on her menses, because we are 100% sure that we are not pregnant and we are not interfering with the pregnancy. Because you may ask, can't we do a pregnancy test? You see, a pregnancy test only becomes positive when there is implantation. So if there is no implantation, then the pregnancy test, there is no hormone called beta-hCG. So there is no, even if we do pregnancy test and the fertilized egg is in the tube,
it's on the way.
It will just come and it will implant. Then we will blame the method, but the woman was already pregnant when we are starting the method.
So the best time to have your contraceptives, any of them, the coil, the injection, the implant, is when you're menstruating. That's the best time.
Exactly.
Unless otherwise, maybe something has come up.
Yes, if something has come up, or somebody because the coil can also be used, the copper T can also be used as an emergency contraceptive method. And the good thing with it is that even 5 days after unprotected sexual intercourse, then somebody can be able to insert an IUD and it will prevent her from getting a pregnancy.
That is new. So you can use it as an emergency contraceptive.
Exactly.
So in case someone has sex like 3 days, you realize 3 days of not taking your emergency pill, you can come and get your IUD and it will prevent you from getting pregnant.
As long as it is within 5 days of the act of unprotected sexual intercourse, then that can prevent a pregnancy happening. But remember also, emergency contraceptive methods are for emergencies. God forbid a couple was using a condom, it burst. That is an emergency. God forbid a woman has been exposed to a pregnancy, has been sexually assaulted, things like that. That is an emergency. But now, other people make emergency contraception as a routine contraception, which is wrong.
That's a really good topic.
So the emergency is what we have agreed. Yes.
So emergency is only when it is an emergency. Not when
a couple cannot plan to have sexual intercourse tomorrow, and then they say that is an emergency. But they could have used the barrier method, like the condom.
The condom,
to avoid taking, especially the pill, that destabilizes the system.
The hormone a lot. Actually, I've seen that, and I think it will give us time. We're going to discuss more about contraception and even the emergency pills and so on, and how they affect the hormones in a woman's body. I think there's someone who doesn't know how a coil looks like. If most people have the imagination, it's something very big.
I know, and especially for us men, we normally show the ladies the coil before they are inserted, so that they can understand what is being inserted within their body. But for us men, the only coil we have ever seen is the reef coil of a pickup. And that's why we feel it sometimes. But the coil is this tiny thing.
Can they feel it actually?
I think it cannot be felt. It cannot be felt because where we insert the coil, like this one is outside, but this one, you see this size of a uterus? So the coil is right in the uterus.
Inside.
So the birth canal is out here. So this is the uterus. And we insert the coil where the baby usually stays during pregnancy. The question I would ask my fellow colleagues, I'm a man also, if you look at this, the baby is in the uterus, but how often or when a woman is pregnant and they have sexual intercourse, do the men feel the baby?
I don't know.
I will ask the men to answer that question.
That's a question you should go and say.
Okay, can answer that question. It's because the coil is right inside. What is outside the uterus, probably the camera cannot see, is these small strings. Okay, because it's these strings that we use to remove the coil.
Okay.
So we cut them short, about 2 to 3 centimeters. And even if I touch my eyes with this string, I cannot.
You cannot even feel it.
I know, you see, it can't hurt.
So this is just an imagination most people have, like you can feel it or something, but it is not real that you can feel the coil, right?
Exactly. Like when we do a coil and then we are sure it is within the uterus, and the man complains, I normally tell them either they come or I give the spouse this coil to take home. And the majority of men will ask, they will say, I was not feeling this. This is not a big happens with me.
So some is just an imagination, I believe. So. And at what point does the coil disappear? There's this point where people say the coil disappears and goes to the heart, the brain. There's so many misconceptions and myths about the coil disappearing in your body. What should you say about that?
That's a good one.
Yeah.
Yes, so the coil is plastic.
Yeah.
The only thing that is metallic are these sleeves.
The copper. Yeah.
Now the coil, we insert it in the uterus.
Yeah.
So what you are seeing in these things here, these are the muscles of the uterus.
Yeah.
Which are the one that contract
the end of
for the myometrium. For the mother to be able to deliver the baby. And it's a thick muscle. So the only time a coil may go beyond the uterus is during the insertion. Like if you don't know the technique and you are using this plastic thing, it can perforate into the uterus and then you place the coil outside the uterus. Okay?
Yeah.
But for this, if it is normally placed, it cannot go to the above after some time. It can't. Normally what it can do is to come down. Okay?
Yeah.
And sometimes, especially for women with heavy periods, like having clots, you might find the coil can get lost outside with a clot of blood, inside the clot of blood. But that means then, of course, the woman will get.
Yeah, but it's not about disappearing inside your body.
But for every method, it has its own failure rate.
Yeah, it's true.
Okay? And the coil, since the woman does not need to remember to take anything every day.
Yeah.
So the coil, the implant have the highest protection of against pregnancy and also the we call it voluntary surgical contraception. So those three have the highest, and if you look at 100 women,
the most sick.
In 1 year, only less than 1 woman will get pregnant. Per 100 women, a whole year of exposure to a pregnancy.
So only 1 woman get pregnant when you're using the coil.
They are very safe, but of course, a few may get pregnant because of the manufactured fault, etc.
Or the method, like the way you have said, someone can insert it outside the uterus.
Or within the uterus, but you see, only God makes this 100%.
It's true.
So that small failure rate is what you sometimes hear. A mother had a normally placed coil, and then she got pregnant, and then it was removed during the no baby counts with the coil holding like this.
It's true. Before we wind up, the last question I want to ask, do they cause infertility? Coil.
One, family planning methods. Remember, like when you use the IUD, it goes for 10 years.
Yeah.
Nowadays, there are some research that has pushed it to 13 years. They are thinking it can even go longer. But remember, we said they are long-term, long-acting, but reversible contraceptive methods.
Okay.
Yeah, we have the short-term, like the pills and the rest.
Yeah.
So, no method causes infertility. What may cause infertility is the intention that I have as a person to use that method. Because there are some people whose intention is to have multiple sexual partners. Remember the coil, because it is not a barrier method like the condom, does not protect against sexually transmitted diseases.
Okay.
So if a person gets a sexually transmitted disease like common, chlamydia, sorry, not like chlamydia or gonorrhea, then they may get tubal blockage because of infection within the tube. So the intention, my intention of using a contraceptive method is to have multiple sexual partners, then That it is the multiple sexual partners that may bring the adenization, which will block the tubes, but cause infertility, but not the method of use.
I think you've heard it from here. Most people heard that myth and misconception about coil causing infertility, but you heard it from a professional, and we conclude that coils are safe and you can use it as a long method of contraception. And I'll go have my coil back after 2 years of not having my coil, and I now have the confidence after asking so many questions about the coil and the pros and cons. And if you have questions that you'd want us to ask Daktari, please leave them down in the comment, and we're going to request him for some time so that we can discuss more about, because gynecological issues are so many and they are so wide. We can ask as many questions as possible. Stay tuned and continue subscribing and liking all my videos. I'll leave the details of Daktari where you can find him. And bye, see you next time.